So, hey guys, welcome. We just start in a moment. Okay, we'll start now. Okay, guys, so I think we should start now. So, welcome to this event today. We're going to host the fourth Painacea Day celebrations today at our clinic. And I think a very uh, emotional moment for us, but definitely uh, also a landmark for all our patients because we have moved ahead in terms of patient safety. I'm Dr. Sidharth Verma. I'm a spine and pain physician, and today I'm going to showcase the new MIPSI equipment which we have acquired over the period of last few years, and it's going to give a great impetus to our patient care. And most of our patients who are chronic pain patients, they're going to have a lot of benefits because of this equipment now. We have been using some of these equipments which are usually not used in most pain clinics, and very few pain clinics across the region have all of these equipments available under one roof. And some of them I'm going to show you today uh, because we'll focus mainly on the new ultrasound equipment which we got for our clinic, which will greatly enhance the results and also help us to achieve new standards in patient safety. So I think we are going to just start. So guys, we'll start with our old equipment. So what we already have in our setup. So this is not something which is very new, but we have been doing it continuously now. Over 100 patients have benefited across the various centers in Mumbai and Navi Mumbai because of this special procedure. And you can see that this is a spine related procedure. That's why I'm holding this model. And this is our patient. Suppose he's lying on the table, wherein with the help of this endoscope, we are going to just visualize and reach his disc. So, for example, you can see that this is the anatomical position of the spine. So, this is how your spine is placed here. And with the help of these special introducers, dilators, and this working sheath, which is the size of this pen. So you can very well imagine how thin. This is my pen, which I use regularly, and this is the equipment which we use. So with the help of this dilator, we actually reach this portion of the disc which is bulging and herniating, and then we put in this sheath, and upon this sheath we put in this scope. This is a very thin, you can see very fine. It's only 8 millimeter diameter scope, and it's very you can see it's very finely articulated. And with the help of this, we connect this to our camera source, and then we view it on a big TV screen, and that we do it in an OT. I just wanted to demonstrate that how fine these instruments are, and we can just, with the help of these instruments, we can just put in these instruments and go there and just take out whatever material we want to take out from the herniated disc, or if you are doing a foraminoplasty, whatever we are doing. And with these advanced equipment, we set new standards in patient safety and care, and we achieve a lot of good results, and many of them are already available on our YouTube page. Those of you who don't know about it, just go on YouTube and type Painacea, Painacea, and I'm sure you'll get a lot of stuff there. And this is something which is very futuristic. Although this is not new, it's been around for like quite some time now, but it's quite futuristic in the way that uh, this is something which will definitely grow. Today price is a constraint, but I'm sure with more and more numbers, more and more doctors, more and more pain physicians, more and more even uh, a lot of surgeons also are now trying to use this for their patients. This is known as a spinal cord stimulator, and you can see this is a very small device, which is I call it the pacemaker for the spine. And this is used for refractory cases. Not only refractory cases, earlier it was only used for refractory cases, but nowadays it has also been used on virgin spines. And also, India is a diabetic capital. So for the diabetic neuropathy patients, this is a new ray of hope who have got a refractory diabetic neuropathy. So, guys, this is about the two things which I wanted to mention, which are already being used. But now let's come to the showstopper, and we're going to just have just remove the ribbon for our ultrasound equipment, which uh, is the one of the most advanced equipment available in the field of point of care ultrasound. And you can see that it's a very sleek equipment. Those of you who are not used to having seen this kind of equipment must be thinking that you have seen bulky machines being used for ultrasound, but this one is a quite a sleek model, and this helps us to save space. And of course, our patients are pain patients, so you'll see not only it has got advanced features, but also it looks quite elegant. I call it the iPhone of ultrasounds. And since in India we are, because of the PNDT Act, we are not allowed to use wireless models. So probably this is the best which I could get. So for a demo, I'll just show you what it can do. It's a magical equipment. I've already put in a YouTube video yesterday. So those of you get time, just watch it. I have detailed what are the advantages of using this equipment. I'll just enumerate them. So I get point of care diagnostic. I get immediate and accurate assessment of the patient. I can immediately use it to do dynamic ultrasounds, which is a very big step ahead as compared to that for a static test like an MRI or an X-ray. This gives us a lot of advantage, especially when dealing in with musculoskeletal conditions. And then of course we can do a procedure if we want more in detailed information. We can take the help of our radiologist friends for detailed reporting, and they are always have been more than happy to oblige. And once we know, we can accurately treat the pathology with the help of this equipment. It has got this particular model has got two probe attachments, so I don't have to switch or change probes again and again. So we can have different probes. I've got one curvy linear one, and one I use the linear one. I use a very small footprint so that I get more space to maneuver. And of course, you can see the controls are minimal controls, and usually this is extremely helpful to a person who's doing intervention or doing a point of care procedure. And we barely do any, we are not focused on reporting and all. So definitely we are more focused on, rather mostly focused on the procedures. So just for the demo sake, now I want I'll just demonstrate on some volunteer how we can actually do it. So we just need a volunteer. I think if anyone can you is Umesh around? Mhm. Okay, so we have Dr. Sasmit. So I'll just request him to just come here and just sit here. Just a small demo of probably we'll be scanning his wrist today, and you will see how easily we can see all this stuff. So it's better for me. So you can see that I can just easily maneuver this equipment, and I just wanted to just it. So thank you, Dr. Sasmith, for agreeing or rather being forced into doing this. So just place your hand comfortably so that and let it hang from here. So you can see how easy it is for me to just scan in my this thing. This is the sterlium, so I made it sterile, and I can easily just put on my probe on the wrist, for example, and you can see that I can straight away see Dr. Sasmith's uh, median nerve in the middle of the screen on top. Okay, and this is the structure which I can see. I can track it up and down, so it's very not very difficult. This is a normal structure for him. So definitely, I hope you don't have a carpet on, right? No. So so we can just see this structure, and I can trace the whole thing down, and this can be done uh, inside the clinic, and you don't need to kind of go anywhere. And it's as easy as that. I can just freeze the image then and there. We have lots and lots of features, but we can just uh, keep on enumerating. I can just even go left and right, just see his vessel. So there is one vessel which I can see, and you can see this nicely illustrated by a Doppler. So this is on the medial side. So it's the ulnar vessel. Okay. So on the middle of the screen, if I again go to the 2D view, I can just take a screenshot, and then maybe I can annotate. So all these features are available for us, and we can just simply measure the thickness. We can measure the cross section. The most important thing in this is, of course, the area, which also we can measure with the help of tracing. And this we can see. Just go back, go in the calipers, just go on the trace, just click here wherever I want to do, and or rather bring it here. Just go on the caliper, click on the trace, bring it where I want to start, and then of course I will just trace it. And whatever size, I can be as accurate as I want, or accordingly I can do it. So uh, I think we can take small clips and all the usual features which are there, plus the ease of using it. And if you want to, if I would have wanted to inject, I can easily then and there only I can just inject it, and the procedure can be finished. So I am sure this will add a lot of benefit to the for the patients. And this is it from my side. Another non-invasive device which we want to show today is the stim pod, and Dr. Sasmit will again help me with the demo of this equipment. And you can see that this is a very small device. It's a non-invasive uh, pulse radio frequency equipment, and you can see it's a very easy to put in device. I'll just show you the advantage. We use it to deliver the pulse radio frequency current to a lot of structures. So for example, I'm now targeting the ulnar region. So if there is a neuropathy, or if there is, I want to just stimulate the nerve. So how I will go, just this is for just for demo purpose, and so that you can just see the how the equipment works. This is the probe, and this is just to complete the circuit. This is the pad. It's just like an ECG electrode. It looks similar to the TENS machine, which is used by the our physiotherapy colleagues, but it's very different in terms of uh, the procedure and everything. So you can see that I'm going to stimulate the trying to stimulate and complete the circuit here, and gradually I'm going to increase this current by just uh, rotating this dial, and we can see that the current is slowly going to increase. Okay, and let me know if it pains. So we're going so slowly going to increase, and we're going to complete the circuit with the help of this. Okay, and I'm going to change the location so as to locate the and complete the circuit. Okay, this is a very fine device, and you can just go on starting to stimulate. So this starts to stimulate. You can see that the contraction is already started to happen. You can see this. Just go and zoom here. Harpreet, show the finger. You can see this. It's already started to stimulate, and so I can decrease. I think it's paining to him, so I'll decrease the current. Now it's comfortable. Yes. So you can see that I this is just a demo for just showing how it can stimulate. And before he gets any neuropathy or something, I'll just remove it. So I don't want any harm. This was just for demo purpose. And guys, this is a very uh, fine instrument for delivering non-invasive neuromodulation. So I wanted to display this because we are doing uh, we don't kind of subject all our patients to unnecessary procedures or surgeries. We have got the option to deliver the physical therapy with the help of our physiotherapists. We have got the option to give the medications. We have got the option for uh, neuromodulation, which is non-invasive, and we have got the option for minimally invasive procedures. So we don't stand to gain if we do your procedures, in a commercial way. So that's the most important. We have got all the things which can be available, so that the commercial bias is taken away. And I think that's the number one reason why we should be the first choice of patients who are suffering from chronic pain. And this is me, Dr. Sidharth Verma, thanking you all for attending this very short demo for the unveiling of this MIPSI equipment, which we have got for our clinic. And we hope that if you have any queries, you'll just get back to us. And I think many of the physicians who refer patients to us will also be seeing these videos. So, guys, if you have any questions, please feel free to ask us. Our team is here to help you. And hoping to see you all very soon. Uh, See you around.